pain relief can be administered in a variety of ways, and actually the chemicals in marijuana that are subject to creating the situation where people feel the need to use marijuana can be given in a variety of other forms, which do not require individuals to light up a joint.
As a matter of medicine, there's really no longer any debate that marijuana can be a safe and effective medicine. That debate really is no longer. And again, my written testimony goes into much more detail about how all the studies, recent studies with federal medical marijuana that have shown marijuana's efficacy for medical use have all been done with smoked marijuana. I'm aware that other people will testify this morning, and a variety of written materials have been submitted to the committee about the research base for medical marijuana, and I don't want to spend a lot of time discussing it. I've actually submitted my own written materials to the committee addressing the studies in detail. I will not talk at length about the variety of organizations like the American College of Physicians, the American Nurses Association, the American Public Health Association, and various others who've all endorsed state medical marijuana laws. I really want to focus on a point that is of contention that I've heard about this morning, which is the issue of smoked marijuana. We know that marijuana can be ingested in a variety of ways. I want to deal with the most contentious issue, the smoked issue. Now, the testimony that I submitted in writing really goes into detail in this, so let me make the basic points as follows. Some patients will find great benefit and have few drawbacks from using smoked marijuana. We know that. We've seen hundreds of thousands of patients across the country successfully use smoked marijuana under their physician's supervision. Some patients, however, particularly those with suppressed immune systems or compromised pulmonary functions, will be advised and well advised by their physicians to stay away from smoked marijuana because of the particulate matters and other aspects that could make their conditions worse. And then there are some patients, and there's actually quite a few patients, that regardless of whether smoked marijuana would actually help them or not, simply refuse to smoke anything. They hate the idea of smoking, period. And so whether it's going to help them or not, they're not going to use smoked marijuana because they don't like smoking. But this is the point. Whether a patient should use or even try smoked marijuana as opposed to any other form of ingestion is an issue to be addressed within the scope of the physician-patient relationship. That is how each of the 13 states that have medical marijuana laws in their books already deal with the issue. They leave it to the physician and the patient to determine what is best for that patient. That approach has worked very well.
Cannabis versus THC. As you know, Marinol it's synthetic THC, but THC is what gets you high. It is the primary psychoactive substance in cannabis. Cannabis has THC and about 60 other cannabinoids, most of which are very minute, but some are important. Cannabidiol and cannabinol are two important ones, CBD and CBN. CBD specifically helps modulate the THC in cannabis. So today they say, well, it's stronger than ever before. Oh, my goodness, it's 25% THC. Now remember, Marinol's just about 100%, except for the sesame seed oil. So you've got this pill that's pure THC. And it was downregulated. It was Schedule II. They found it so safe. It's the only drug ever to be downregulated. They put it down to Schedule III, which means physicians can prescribe it for whatever they think is okay. In Schedule II, they're really stuck to just the nausea, vomiting, appetite stimulation. When it moves down to Schedule III, less restrictions, physicians can use their judgment on this. But it's got CBD in there. CBD helps modulate that effect. So it actually dampens down the high from the THC. So again, they say it's stronger and more dangerous. It's nowhere near the same as Marinol. It is not that high a content, and in its natural form, the other chemicals in it work to make it safer. A physician in Iowa described it beautifully. If you're going to make a cake, you've got your eggs and your flour and your sugar and your butter, etc., and you make the cake. You've got these ingredients. And that's what we have in cannabis, a whole bunch of ingredients. We have about 400, just like in a tomato plant or garlic or any other food substance. But then you put them together in the plant, and you can get a cake. it looks, it tastes, it is entirely different than those ingredients. So the point here is THC, cannabis, two different things. You can't compare them. It is effective for some patients, the THC, but it does not have all the therapeutic products the other one does. Another research.
And actually, the chemicals in marijuana that are subject to creating the situation where people feel the need to use marijuana can be given in a variety of other forms.